the whole thing. It be like say, you know, doctors are always in a hex to go give injection or to go prescribe. It be like their own prescription they prescribe, while others go to give. If you talk them now, they go give injection now, they go carry you go straight to high court, not below one. You understand? So I just release them sharp before I go to WhatsApp segment. And now today now, so I go do. So we're going directly to women breast now. Talk to the doctors. There were some important things we were to discuss the last time I met with them. We not fit discuss. Thank God, sir, I don't go bring them back, because when they come the last time, where they can't go, a lot of people come. They call me, loaded mama. My wife get belly. Give me the number of those doctors. Give me. I say, hey, when doctors they come, write down your questions and get ready to ask them, because some of them know they appreciate. Say you go give them the number, because they don't know whether you go come give them upper cuts for their house, you know, or whether they come in peace or for work. Doctors, they do the fear. I mean, they tell you, even both of men of them, those male doctors, they fear like chicken. I'm telling you, how much more the ladies. So now, so they listen, where if anything where they worry you, you know, please just get yourself ready. Send text now, you know, ask your question when I open phone line, or you send text, I will just ask them, they go answer, whatever be the case, you know. And today we're looking at pregnancy and bleeding. Pregnancy. Okay, they talk about general bleeding. I don't know, say general. Okay, aha. They say vagina. I mean, I don't know if it pronounce that. They pronounce them pum pum bleeding. And now some women too, after they don't get belly to bleeding the day. You know, so what's in the cause that? Let's go to that one first before we can go to vagina bleeding.
Okay, so with pregnancy,
yes.
There are times people get pregnant and they do have a slight bleed, patient bleed.
Okay.
That's when the baby or the fetus, as they call it, when it's implanting into the uterus,
okay,
the womb,
okay,
a woman bleeds.
That
is not a big problem. But there are different stages where a woman bleeds and it becomes a problem. Like if you bleed in your first trimester, or you bleed in the second trimester, or the third trimester,
okay,
they all have different meanings.
Okay.
Yeah, so if a woman is bleeding in the first trimester, which is the first 3 months.
Okay. I nearly won't ask you that English. As I hear trimester, I say, thank God you don't explain them. You know, so 3 months, now they fire that English.
So 3 months,
no,
3 months, altogether making 9 months.
Alright.
So
now, before you continue, you say when the pregnancy, when the fetus is being planted inside the womb, you know, which means some people they talk say when did they get belly, you know, automatically they know they see blood at all. You know, some women say, oh, I get to know say are they pregnant because this month I don't see blood. You understand? Some women say, oh, I they see blood for 3 months now. I they bleed normally, they have my menstruation. But as I go, doctor talk say picking day inside my belly. You know, so what in the cause all those ones?
I think everyone is different. Every person is very different. There are people who, when they get pregnant, they don't see any blood.
All right.
When there are people too, if you have irregular menstruation, you know, sometimes you can miss it this month or it come next month, so you're not even sure.
Okay.
When you're getting pregnant. So those people, when they get pregnant, they don't even know. They still bleed because they have irregular menstruation.
Okay.
But if you have a regular one, usually like you know every month is coming, it's constant.
Okay.
When you're pregnant, you know, you should know because you don't see anything. But there are people who also bleed a little bit. The first month.
Okay, to add on to
that was Dr. Diana talking to us. Now we go to Dr. Grace. Let me make this announcement. You didn't one particular man where always they call me. After my doctors don't come to the studio, he go call me with one private number. That man, if he they listen to us today, I feel like I will make this announcement. The next time you go call me, please call me with your original number and no more private number. I know they admire my doctors. But pay tax to me before anything. All right, Dr. Grace, continue. Yes, my dear.
Thank you very much.
Yes.
With regards to bleeding, I would say that the amount of blood one sees is a red flag. And then the color too, the color of the fluid that one sees too is also a red flag. Okay. We have spotting, we have bleeding. With spotting, it can happen just about the time that one is expecting the menses, or after the menses, or after intercourse, or just when, like Diana said, when there's implantation of the fetus. Okay. Like with.
So you
with
mean a person fit get, let's say like maybe your menstruation will come, let's say on 1st April, okay?
There's something like spotting.
You they call it spotting.
With the spotting, you see brown fluid.
Okay.
Or pink fluid.
Okay.
That's not real, like bright red. That's
right.
spotting.
Okay.
But with the bleeding, it's bright red.
Okay.
So if we distinguish them like that, so we need to distinguish them like that. So
the
that,
color of the blood when they come out.
Before somebody will say that I'm seeing blood.
Alright, so now if you see the brownish kind of liquid,
that's spotting.
That is spotting.
Yes.
Now the amount of it, if for plenty or maybe small.
So very small. Like with spotting, if it happens just after you've had sex. Okay. Then if you see the brown whatever just after you've had sex, then it means that it's just minor bumps or irritation that you are experiencing. Okay. But then if like Nana said, if just about the time that you're expecting to have your menses, and you didn't see your menses coming, but then you've had intercourse already, and you are expecting. You're anticipating to expect some form of pregnancy. Okay. Then that's where Dana's view of implantation would come in. Okay. So then.
Wow. Well, listeners, we are talking about pregnancy and pregnancy with bleeding, and then they go come move to vagina bleeding too. So whatever be your question, whether you are changed, I like people are sharp, but some people don't already send questions. I will read some of them to make the doctors also answer. The number again for the questions now 0277846260, and like I always said, as usual, this particular show you can also subscribe to our YouTube where we loadedmama.tv. Subscribe to our YouTube account, and that will be loadedmama.tv, and then you get to see even these doctors physically, and then they talk also. It is very important. Or you can also get me for Facebook loadedmama at Naija, or you write to me loadedmama20@gmail.com. We are continuing the tutorials with the talk now. Some women sometimes said until they get up to about 7 months before they get to know they are pregnant. Is it possible?
Yes, it's possible.
Why so? How woman go get belay, you know go know. And it's just normal until around that kind 6 to 7 months before you go know say you're pregnant. Maybe you can't go hospital. What do you think? This one a witchcraft?
Not at all.
Oh, not at all. Oh, okay.
Not at all. That's why you are saying is the person, if the person doesn't know, does the person still have menses?
Oh yes, some of them say they still have menses. Yeah. Sure.
Yes. It's also possible that you can have some slight menses,
okay.
But that doesn't mean that you still don't have the baby.
Wow.
But my thing is always when a woman is having sex, you should always bear at the back of your mind that you'll get pregnant soon.
Okay.
So even if you are hoping to get pregnant but then you are still seeing your period, always do a pregnancy test.
Yeah.
Because I actually have a patient who didn't know she was pregnant until 5 months into the pregnancy because she had irregular periods, so she wasn't even sure that she was pregnant. Okay. So my thing is
until 5 months before you don't know.
Yes, and that is kind of dangerous because a lot of things happen in the first month.
Okay.
When you're pregnant, like organs are forming, and that's what people don't know, so they start drinking and drink other things that causes the baby to come in all these different abnormalities. So if you're having sex, or if you know that you had sex, and you're expecting to get pregnant, and you didn't miss your period, go get a quick pregnancy test. You can do it at home by yourself.
Wow.
Or go to the nearest facility, hospital or clinic, and they can just check it for you, so they can start treatment.
Wow.
Because losing blood when you're pregnant is not really a big sign.
Yeah.
But I've been thinking that from 4 months, baby is supposed to begin to kick for belly. That's what I suspect though. From 4 months, baby will begin to kick.
No, not like that. But you should feel fetal baby kicking.
Okay.
About 6 to 18 weeks. You should feel the baby kicking.
Wow. Now, there is a lady who actually, sent this question. He said he wanted to know. Normally she normally have sex during after the first 9 days after menstruation. Then she normally have sex only 3 times. And she's like she does it that way knowing that in order not to allow the man to spoil maybe the implantation, because he feels that when the man enter the first one, the second one maybe there was something there forming. The next meeting, the man goes scatter waiting it up for. So now you go get sex only 3 times. After 3 times, you go tell the man, yeah. Come on for road, make scatter the farm. All right. Is it right, or is it true too medically? Or if you just they have sex until maybe after that month before you go begin the monitor the implantation. Good.
I had a patient who came once and she was pregnant. She knew she was pregnant, but she kept on having sex even when the baby was 3 months.
Okay.
And so it got to a point the fetus just aborted. And so that's what they always tell you, if you are like the first couple of months pregnant, take it cool.
Okay.
But it doesn't mean you shouldn't have to have something. Don't be too aggressive.
Okay. That one now mainly for one now, not with the woman.
But the man can wait for 9 months. What is wrong with that?
Hey, can you imagine? Well, listeners, we are still on the women brief. That is the segment where we talk about women matter. Today we still there for health, and we are talking about the pregnancy and pregnancy in bleeding, and then vaginal bleeding. Maybe we'll move to vaginal bleeding. Now let me ask: when a woman is having, let's say miscarriage, first one, it depends at which type of miscarriage we're supposed to take woman to go and do what we call washing, to wash the womb. Is it when you miscarriage, let's say maybe you realize you just miss your period for about 3 weeks, you miss your period for, let's say, for a month or 3 weeks. Which of them? Because some women have miscarriage and they don't really care about going to do any flushing or anything. You understand? Some just flow like that and the belly will come again. Some too until they go and wash it. So say something about that.
Usually with miscarriages, it has to happen within the first 3 months. So anytime you are bleeding within the first 3 months, they call it miscarriage.
Oh, right.
Yeah. So when that happens, you are bleeding a lot severely, like maybe get into shock. You become very weak, and just like, signs of shock. Fatigue, you can't do anything. I always say you report to the nearest facility.
Okay.
Because at times you may bleed, but everything has not come out. The product of conception is still in there, and if you don't take time, it can become diseased. It's what they call septic abortion. So that when it's left behind, we start having bacteria and start growing on it. I've seen one. And they have a very bad smell. The vagina smells really, really bad. So you see that, or like when you notice that you are bleeding a lot and you are sure you are pregnant, just to make sure your womb is clear, go and do what is called the manual vacuum aspiration. Whatever is left,
you
just like take it out and clean it for you.
That is, let's say when it get up to about 3 months before.
But even if it's less than that and you notice you are bleeding within the first 3 months you are bleeding, just go and let them do the scan to make sure there's nothing in there. Don't be home.
Wow. Somebody said having pregnant after about 7 years of last baby. What do I do? What to do? What is it? Okay, what do I do? Medical advice, please. Is that what? Okay, well, the person didn't send the age. Please, when you send question, just send your age. Another person said, please, I feel I am pregnant. Every time my tummy is growing bigger, I'm not feeling any kicking, no movement. And I've already told my man I'm pregnant. And my man has already given testimony in the church.
Absent of it.
What do I do?
Movement.
My dear, God bless you for coming. Your final word. Just advice for women.
About the vaginal bleed, it's very important for every young girl out there. If you're sexually active, go and get a pap smear done. It's done at Kolebu for 50 Ghana cedi. They will check your vagina and your uterus, the cervix, to make sure everything is fine. If they find any lesions there, they will treat you, you'll be fine. If you don't do anything until you're like in your 50s and so on, that's when you start getting the cervical cancer they will preach about. So get tested, get examined, and get treated.
Wow, thank you very much.
Okay, what I was saying is that I still stand on the point that the amount of blood one sees is a red flag.
Okay.
So just also be on your lookout, and then be on your watch out, and then just like Diana said, if you are sexually active, get tested.
God bless you, my dear. You people are too much. Well, listeners, thank you very much.
She's back on your way.